accidents may happen anytime, anywhere, and to anybody. I believe we commonly heard this adage then and now. At the point where an emergency strikes, anyone does not have enough time to begin inquiring about how to react. For our security and the well-being of our loved ones is a smart way to find out about emergency protocol and first aid strategies. By learning ahead of time, we can guarantee that you can react quickly and suitably if there's ever an emergency. This is the very reason why this module is designed to help the learner know the basic concepts of first aid. Attending to any emergencies is somehow crucial. However, if an individual is well equipped with knowledge and skills in first aid, then most probably lives can be saved from life-threatening situations. Thank you so much to the Division of Elegant City for the ADM. Once again, this is Teacher Eugene, your Familia from Lorette National High School, Division of Eastern Samar. Welcome back to Home of Opinions, Familia TV. Going through this module, you are expected to identify common injuries that may happen during a sports tournament, simulate the application of first aid techniques. But before we go to the lesson proper of this module, let us try to check whether you are still familiar with the words used in first aid. So here are the common terms used in first aid. Fill in the missing letters to completely form a word for each item. Number 1, it is a skin cut or broken, typically open or closed. The correct answer is 1. Number 2, it is a medical term for a broken bone. The correct answer is fracture. Number 3, it is a condition wherein the body is not getting enough blood flow, which can be life-threatening. Correct answer is shock. Number 4, it refers to an injury that gives a feeling of discomfort caused by exposure to heat, flame, chemical agents, radiation, or electricity. The correct answer is burn. Number 5, it refers to a physical suffering or discomfort caused by illness or injury. The correct answer is pain. Number 6, it is the inability to breathe because the trachea is blocked, constricted, or obstructed. The correct answer is shock. Number 7, it refers to harm or damage to the body due to the accidents. The correct term is injury. Number 8, it refers to a tactile arterial palpitation of the heartbeat. The right term is pulse. Number 9, it refers to a condition wherein a person loses its consciousness for a short period of time. The correct term is faint. Number 10, it is a wound caused by a tear or a deep cut in the flesh or skin. The correct answer is cuts. What is first aid? First aid is an immediate or temporary care given to a person who has been injured and suddenly taken ill. It includes self-help, and home care if immediate assistance is not available or delayed. Are the following an objective of first aid? To alleviate suffering. Check. To prevent added or further injury or danger. Check. To prolong life. Check. So all of these three are the objectives of first aid. Then what are the common injuries may encountered by the player, athlete, or sports officials in any sporting endeavor? Here are some of the common injuries that is usually encountered by a player or an athlete and its corresponding first aid treatment. The first one is sprain. Sprain is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. This is how to treat sprain. 1. Loosen footwear and immobilize the ankle. Then apply the rest, ice, compression and elevation or the RICE principle. The victim's physician may recommend an over-the-counter anti-inflammatory medication appropriate for the victim's general health such as aspirin and ibuprofen. Another is strain. A strain is a twist, pull, or tear of a muscle or tendon. Tendon is a cord of tissue connecting muscle to bone. Symptoms of a strain include pain, muscle spasm, and loss of strength. How to treat strain are: first, apply the rest, ice, compression, and elevation or the RICE principle. Next, do not apply heat during the first 2 days. You may use paracetamol for the first day of injury to reduce pain without increasing bleeding. Then apply arnica oil to reduce swelling. After 48 hours, start moving the affected limb gently and gradually increase the range of movement or let the pain be your guide. Another is fracture. Fracture is a break in the bone that can occur from either a quick, one-time injury to the bone known as acute fracture, or from repeated stress to the bone over time known as stress fracture. How to treat fracture is that immobilize the affected area. Next, keep the limb in the position you found it and place soft padding around the broken bones. Splint the injury with something rigid such as rolled up newspaper or magazines to prevent the bones from shifting. If there is an open injury, cover it with a clean gauze pad. Apply pressure to control bleeding. Get medical attention immediately. Fractures of the femur and pelvis may cause severe internal bleeding. And most importantly, don't give the person anything to eat or drink in case surgery is needed. Next is muscle cramps. Muscle cramps is a strong, painful contraction or tightening of a muscle that comes on suddenly and lasts from a few seconds to several minutes. First aid for muscle cramps. Stretch the cramped muscle and gently rub it to help relax. For a calf cramp, put your weight on your cramped leg and bend your knee slightly. Try pulling the top of your foot on the affected side toward your head while your leg remains in a straightened position. This will help also ease a back tie or hamstring cramp. For a front tie or quadriceps cramp, use a chair to steady yourself and try pulling your foot on the affected side toward your buttock. Use a warm towel or heating pad on tins or tight muscles. Give conscious victim water or drinks with electrolytes and carbohydrates as much as he or she wants. We also have heat exhaustion. It is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Treatment for heat exhaustion. Have the victim lie down with his or her feet elevated in a cool place. Keep the victim cool. Then remove excessive clothing and loosen tighten clothing at the neck and waist. Give the victim electrolyte beverages to sip or make a salty drink if the victim is conscious. Next, monitor the victim for signs of shock. Then if the victim starts having seizures, protect him or her from injury and give first aid for convulsions. If the victim loses consciousness, give first aid for unconsciousness. This time we will test your knowledge about first aid. We are eager to know if you have comprehended the discussions we have earlier. Remember to analyze each item before writing your answer. You write the letter of your choice on the space provided before each number. Number 1. Before responding to a first aid scenario, what is the first question you should ask at the scene? A. Age of the injured or ill person. B. Safety of the scene. C. Nature of the injury. D. Time of the injury. Answer is letter C. Number 2. Your younger sibling has fallen and twisted his ankle. What is the key action you can take to help? A. Apply something cold to the injury. B. Alternate applying something hot and cold to the injury. C. Apply something hot to the injury. D. Apply an ointment to relieve pain. Right answer is letter A. Apply something cold to the injury. Number 3. What are the signs to look for if you think someone has a strain or a sprain? A. Bruises. B. Pain. C. Swelling. D. All of this. Correct answer is letter D. You're helping someone who has a strain or a sprain. Where should you place the ice pack or bag of frozen ice? A. Enwrapped and close to but not touching the injury. B. Wrapped in material and close to but not touching the injury. C. Wrapped in material and directly to the injury. D. Enwrapped and directly on the injury. Correct answer is letter C. Wrapped in material and directly to the injury. Number 5. Your friend has a strain or a sprain and you apply something cold to the injury. How does this help? A. It will reduce swelling and pain. B. It will help to keep the joint still. C. It will calm the person down. D. It will reduce the risk of scarring. Correct answer is letter A. It will reduce swelling from the pain. Number 6. Which type of injury results from extreme stresses on a bone? A. Muscle strain. B. Ligament sprain. C. Dislocation. D. Fracture. Correct answer is letter D. Fracture. 7. What tissue connects bone to bone? A. Ligament. B. Tendon. C. Cartilage. D. muscle. The correct answer is letter B. Tendon. Number 8. What is an open fracture? A. It is a break with 2 or more fractures of the same bone. B. It is a break of a bone joint. C. One in which the 2 sides of the break do not touch each other. D. One in which the sharp edges on the bone cut through the skin. The correct answer is letter D, one in which the sharp edges of the bone cut through the skin. Number 9. Which best describes a condition whose symptoms may include heavy sweating and rapid pulse, a result of your body overheating? A. Heat exhaustion, B. Heat stroke, C. Heat index, D. Heat cramps. The correct answer is letter A. Heat exhaustion. Number 10. If someone is suffering from a heat exhaustion, what should we do? A. Immediately call emergency hotline. B. Remove them from the sun into a shaded area. C. Give them water. D. Put water on their body to cool them down. The correct answer is letter B. Remove them from the sun into a shaded area. Let's check this time what you can do. For online learners, you are going to make a simulation video. Assuming that you are an officiating official of a certain sports tournament in your respective homes. Okay, you are going to choose from any of the following types of injuries: ankle sprain, leg strain, arm fracture, leg muscle cramps, and heat exhaustion. Refer to your modules for the assessment rubrics. While for non-online learners, you are going to answer the situation analysis on your modules. And here are the correct procedures for each of the following situations. Big love shout out kay Ma'am Carol Vlog Turkey, Lanz Narvaez Vlog, sa Team Kabatang kay Sir Familia Feliz Vlog, my new channel members only Rodel, Zenki Adajar, and jhay 23. Please support them too by subscribing their channel and the description of this video. Happy learning, Kamapelias!